September is Peripheral Vascular Disease Awareness Month. Get this, 8.5 million people in the United States have that disease. So we are happy to have back Dr. Goki Akinwande. He is here this morning with Midwest Institute for Nonsurgical Therapy to tell us the best treatment options. Good morning to you, sir.
Good morning. Thanks for inviting me back.
We are thrilled to have you back. First off, though, this is a mouthful. What is peripheral vascular disease?
So peripheral vascular disease is basically narrowing of the arteries in your leg. And what happens is that you have poor blood flow to your feet that can cause pain, cramping like Charlie horses at night. It can cause numbness and tingling, but worst of all, it can cause wounds in your legs that don't heal. And that's when we're very, very concerned about it, because it can increase your risk for amputation.
I'm glad you mentioned the word risk. That goes well into my next question. Who is the most at risk for this?
So the highest risk for this is actually diabetics. So a lot of amputations happen in diabetics because they have peripheral arterial disease. Also smoking, but age over 65, high blood pressure, hypertension, or dyslipidemia, which is high cholesterol, are risk factors for this.
What are some of the symptoms that people might notice before they come see you?
So it'll be cramping, pain in the legs, numbness, tingling, but the most important and also the highest risk is, or symptom, is a wound in your leg that does not heal. And that's the one that we're very, very concerned about, and you have to see a vascular specialist such as myself.
When you say wound, is this like a bruise that pops up that won't go away?
No, like an open wound.
Okay, so something very noticeable.
Exactly.
Okay.
So.
How do you treat this?
So you can treat it non-surgically, and it's important that you come early because you want to prevent a big amputation, which is a big surgery. If you do, we can go through a pinhole incision in your wrist or your groin, get in there, and then we can put a small balloon to open the artery up. We can also place a small stent to keep the artery open, and this usually heals the wound or gets rid of the symptoms.
It's just fascinating to hear about the technology, and no one would want to lose a limb, and you don't have to, I'm guessing, if this is caught early.
Absolutely, absolutely. The earlier the better. Come early, don't wait.
Doctor, good to see you again.
You.
And if you want more information, head over to Midwest Institute for Nonsurgical Therapy at 777 South New Ballas Road, Suite 212W. And they also have satellite offices in Bridgeton, also in South City. And you can look them up on the web at mintstl.com or give them a call at 314-380-3099.